Alli, what should we do when we have an ache or a pain? Should we just ignore it? How long should we deal with it? What should we do?
Well, a lot of us do, and we ignore it for a long time, and then it can cause other problems. And the good news is we have an expert on today to help us figure that out. We have Josh Beagle, who's a physical therapist with Elite Movement Specialist, and he's going to tell us when and what and how to deal with those nagging aches and pains. Let's dive in. Welcome to the Girls Talk Healthy Aging podcast, where we dive deep into pressing health and fitness issues facing aging women. I'm Alli Kerr.
And I'm Shawna Kaminski. And together we'll bring candid conversations, expert advice, and personal stories that will inspire and empower you on your own wellness journey.
One of the things that I see so often are clients in pain and clients that have been in pain for way too long, and we just ignore those aches and pains and don't know what to do or feel like there's really nothing that we can do beyond some major surgery that's going to take us out forever. And so today we're excited to have with us someone who can help us understand our options and help us just figure out what to do. So welcome Josh Beagle, who is a physical therapist in Macon, Georgia. Thank you for joining the Girls Talk Healthy Aging podcast today, Josh.
Thanks for having me.
And I just have to say major thanks because Josh not only is joining us today, but on very short notice. So shout out to you for jumping in and just being ready and willing to do this on the spot. So we appreciate it. So Shawna, you want to jump in with some physical therapy questions?
Well, I think before we, jump in a little deeper, I just want to clarify, what is physical therapy? There's a lot of people out there that just don't have, maybe have not experienced it. And, it's kind of scary. They might not know what to expect. So tell us, what does a physical therapist do? What can a person expect when they go to physical therapy?
So a physical therapist is really, we put ourselves in this niche as the movement experts. We are advanced trained in anatomy principles, so a lot of ligaments, bones, muscles, and kind of how they should all interact with each other. When someone comes in, my first goal and my partner's goal is to really get to know that person. That first visit is really finding out what is your why. So yes, you're in pain, because rarely do people come in just to say, hey, so you're in pain, but why is that important? Do we need to get this pain addressed? What is your underlying goal? Is you want to get back to an activity, you want to work on your fitness, you want to be able to get in the floor and play with your grandkids or your kids or your dog. So that's the biggest thing. And what we want to work with people is we want to tell them you're in control. So my role as a physical therapist, yes, I'm the doctor, but I'm here to be a guide. I want to educate you, and we want to treat not just the painful region, but the whole person. So we really want to dive into, are you sleeping enough? What's your nutrition like? Are you checking all those low-hanging fruit to help us recover and really dive into how do we move on from here?
And how has physical therapy evolved through time versus the options that are maybe available, or how it's changed? Because some people may be thinking of physical therapy years and years ago, and I know there's got to be changes. So can you tell us about some of those things?
Absolutely. So just a history lesson, physical therapy started back in World War I. So soldiers returning from home, and with the polio epidemic, started in the hospital mainly for that recovery purpose. And over these decades to a century now, we've really are in every aspect of life. We're in the hospital, we're in major corporations, because business owners found that it was better to have us in staff, keep people from lifting poorly, causing those injuries that need to go to work comp. We're on every floor of the hospital. We're in schools. We're on every sports team. And really, we are moving forward to a very proactive approach. So gone are the days of you coming into therapy and you're going to get a hot pack in 20 minutes on stim and we're going to send you on your way. So you should be working out. I tell patients, like, it's okay to sweat in here. That's what we're after. But the goal is to really make people stronger. The stronger you are, you're not going to prevent injury, but you're going to make it harder to get hurt. It's also going to expedite your recovery. So that's our big thing.
Yeah, I really love that. And I've had great experience with physical therapy. And I've used it in a proactive way. I kind of have my PT on standby. I just make an appointment every 6 weeks and go in, and it's like, what's bothering you today? And so I just always have something that I'm working on. But I don't think that many people are proactive like that because it costs money, but I just feel like I'm investing in myself. But for those people that are more reluctant to come in to a physical therapist, like when should they come in? I'm just going in even before I'm in pain because, when I think about it, it's like, oh, this shoulder is a little niggly. So then I get, some activities to do with a band and that kind of thing to, get things working well. But some people are in pain for a really long time. But how long should they be waiting? Either once they feel a pain or a niggle, if they've had an injury, like what's your recommendation?
Well, first, I love that. Love that you're being proactive. That's one of our core values is we want to play offense, not defense. So I usually tell people, and what the research shows, on your very low level injuries, muscle strains, you slept funky, got a crick in your neck, usually a week, week and a half, it should settle itself down. Most research, when in terms of low back pain, minor low back injury, such as just a low level tweak, should start to heal itself in 2 weeks. If we're getting past that 2 week mark and your pain is either progressively getting worse, quality of life's getting impaired, you're having to rely on other people or you're having to stop what you love, then it's time to go and get it checked out. So, depending on the state that you're in or country, if you have direct access, physical therapy is great for being able to get in and triage. So, can we treat it conservatively? When people come into us, so I'm in Georgia. With Georgia, we have direct access for 8 visits in a 21-day span. So, people can come in if they will say rolled their ankle, something like that. We can save them that trip to the ER or the urgent care, save them that trip to extra imaging just to basically get a bill to insurance. So if it's lasting more than 2 weeks, we want to dive in. Can we start teaching you some stretches, like you mentioned, some band exercises to get proactive? Because most people, once you start promoting that blood flow and really stressing that tissue, it's going to heal itself and move on. There is a point though where you've waited too long. So as you get older, if you have like a tear in the rotator cuff, when it comes to tissue integrity, there's a point where you can tear something and it's gone too far and they can't reattach it. So it's going to vary case to case, and the age of the person. Were they active before they got hurt? Were they inactive? What are their demands day to day?
I have a
Yeah.
question, Josh, just because I think a lot of people may not know what this means. When you say in Georgia, and this is, Georgia law, direct access, can you explain what that looks like versus not direct access?
So with direct access, it means strictly that I can see you before you go to a doctor or an orthopedist. If you don't have direct access, you have to go through either your primary care or your orthopedist, get a script, they'll send you to therapy where you'll have an evaluation and it kind of dictates from there.
And you're saying that there's 8 visits before you would need to go in Georgia. Now, check your state laws or your country that you're in, but in Georgia, you can do 8 visits before you would need a referral.
Correct.
Okay. Just want to
Yeah.
clarify that. Yeah.
There's
And
actually there's a bill on the floor in the House of Representatives in Georgia where they're debating on full direct access where there's not a time frame. So that's currently getting voted on.
wow. So yeah, so there you go. Something to be informed about. That's awesome. And talk to me about, because y'all have a different model. Your facility, you're at Elite Movement, and you have a different model than some other therapy. So can you talk a little bit about that for people that may be in the US or may not know about the different options?
So with my clinic, and I'm part owner with my partner, Paige Parker. So we are an out-of-network facility, which means we don't bill insurance directly. But with our clients, we provide them with a super receipt that has all the codes, that diagnosis codes, treatment codes that their insurance would need. And based on their insurance plan, if they have out-of-network benefits, we're having patients who are getting 50% reimbursed all the way up to 100% reimbursement. The reason we went with this model is with insurance, the payments are getting less and less. So both my partner and I came from an in-network practice. We had to see more than one patient an hour. And for me personally, I didn't find that nearly as rewarding. It felt like I was juggling a lot of people in the air and I couldn't give my full attention to each person. So with my model, we're working one-on-one with people for an hour to hour and a half as needed. We can go down the list of multiple areas, whether some people come in with the shoulders hurting, shoulder feels better. Well, my knee's been bothering me for a couple of weeks. We'll look at that as well. But we have that time and can give that one-on-one kind of personalized care.
Yeah. So if I were to go into like a in-network kind of through insurance route, the difference is like if I have something going on with my shoulder, they're just going to look at that, right? Versus where you could
Yes,
have a more broad approach and look at things as more, look at me as a whole person versus just that one area. Is that what I'm
correct.
getting?
Correct. So they have to follow what that script says for that person. So if the shoulder hurts, we're looking at the shoulder. You can gray the lines and look at the neck because sometimes you'll have shoulder pain referred from the neck, whether you're getting some nerve involvement, things like that. But it is kind of point specific when it comes to legality issues. And the biggest
Yeah.
thing is what a lot of people don't know is Medicare really drives the boat on this. So there's current estimates that Medicare is going to run out in 2040 or 2050. No one knows exactly, but each year they have to cut their payments to prolong it. Well, if Medicare is cutting payments, and it varies state to state, insurances are going to pay less and less. So in their facilities, are going to have to see more and more people to just maintain the level.
So for you, Shawna, I know you're in Canada. I don't know if you can speak to kind of the process you've gone through and how that might be different, just so we are educated on the differences.
Yeah, and I mean, honestly, I'm not an expert on this at all, but I have not needed a script to see my physio after hip surgery. I had because I'm paying out of pocket, but I think I get 20% coverage from my Alberta Blue Cross up to a certain number of visits. But then after, both my hip surgeries, then I had a certain number of PT sessions that were covered by the province, but they didn't address my needs because people getting hip surgery, I'm not the usual candidate. And so they I I wasn't, I mean, the physiotherapists that were provided to me, it was more of a group setting. I was with 80-year-olds. It just didn't, I mean, I had done so much prehab before my surgeries, like it just didn't meet my needs. So I just wanted to pay for it myself. So there is a certain number of visits that are covered depending on, what your ailment is. And, but now with my physical therapist, I just book on my own. And what I really like about it here is that, like, I feel that a lot of physical therapists must be like a bit hamstrung by the fact that, oh, this person comes in with a shoulder issue, but I'm not technically allowed to address the neck where the problem is, like where you have to kind of shoehorn the modalities and treatment based on what the prescription is. So that's kind of unfortunate in some states, by the sounds of it, of how you have to be cared for rather than as a whole person, which you've chosen to go a different route, Josh, so that you can do that in your clinic, which I love, because the shin bone is connected to the arm bone, like everything is all connected. And so, when I go in and talk about, oh, I've got foot pain here, and it's because, oh, the opposite hip or whatever, I feel like my physical therapist, he's like a magician. He is so intuitive. I feel so fortunate that I have access to him. And that's why I'm proactive with, because I'm going to be moving and competing and doing all the things even in my 80s up to 100. So I got to, it's like you wouldn't just drive your car off the lot and then never go get it serviced.
Absolutely.
People take better care of their cars. And it is so little of investment. If I go see Tyson every 6 to 8 weeks, even if I'm not in pain, if I'm spending $80 to $100, and then I do the physical therapy that, I'm compliant with what he has me do, like I'm going to stay mobile. But I'm so frustrated with, some people that I talk to and clients that are in pain, but they don't do anything about it. Oh, I just, I just won't move my shoulder. It's like, well, have you heard of frozen shoulder? Because not moving it is not the answer. So, I mean, we're here, and that's why we have you here, Josh, is to get people in because motion is lotion, but we don't want
Amen.
you moving in pain, right?
Right. So
Can you,
when I see people, and there's a gentleman that I know who's in his 70s, he's coming off of a year of bad back pain, and it's kind of fluctuated up and down. But he met with me on and off. We gave him some exercises, some movements to do, but he has been diligent on it. And come to find out, 20 years ago, this man broke his back. But he has been so proactive. And every time I see him, he's got to tell me about he's told another guy or another friend of his to do this stuff. And these people are older than him. They look horrible. And he goes, well, if you just do these exercises, you're not going to be laid up like this. But it's just choosing your heart. And like he goes, like, he
yes,
can't sell everybody on it. And it's, you can pay for it now and be proactive about it, or you're going to be paying later down the road because there's other medical things that pop up.
exactly. Can
Yep.
you talk a little bit about like some of the modalities that you use, like PRP and dry needling? I've come to realize that like INS or dry needling isn't approved in all states.
So we use dry needling a lot. So I use everything from headaches to tendon pain. And really what it does is it's just promoting blood flow. There's research to show that it helps with hormone reuptake to really limit that pain. But picture it as like a very point specific exercise to improve vascularity to that area and help lower the threshold to pain with that. So we use that. We don't do PRP injections. That's outside of our practice scope here. But we have several patients who go to orthopedists in Atlanta and get those, and there's good results from that. Other things that are out there, blood flow restriction, which has been shown great for especially people who are post surgery, where it's you have an occlusion of a blood vessel, varies by gender and age on how much is occluded, but you'll do a very light exercise with it. It's going to improve blood flow, but it's going to promote growth hormone production in the body, which further helps that tissue repair. So ACLs, shoulder pain do wonders with that. We'll set people up to use, like, if they're going to use IFC and TENS units at home for just pain management, but we're sure to kind of educate them on this is not going to fix the issue. It's just going to help lower that pain level going on.
And why do you think, because I'm with Shawna, I get so frustrated as a trainer because I see clients literally hobbling in. You can obviously tell they're in pain, and yet they refuse to address the pain. And I think a lot of it is fear, because I think that they're afraid or assume that there's going to have that there's something majorly wrong and they're going to have some major surgery, when oftentimes that's not the case. I mean, maybe that's the case, but maybe that's not. And I see clients that are just afraid to even get the answers, like to even know what's going on. So how do you, like, what do you think that is, why are people so afraid to check into their pains? Do you have any insight?
Just hypotheses, but really, if you look at Google, you find out something's horribly wrong because you'll go down the rabbit hole
Oh,
down that one.
don't Google.
But also, a lot of times people they'll go into see their doctors, and it's just that kind of, it's black and white, and they don't see a gray spectrum. So like they'll go in, if something hurts, how many times have we been told don't do that? So I've had very young people in their 20s who go see the doc. They've got some patella tendonitis, so ligament on the front of the knees hurting them, and they're told never squat or lunge. Again, avoid stairs. And I have to be quick to tell them, well, you're not going to get on the toilet, you're not carrying your groceries in, and you're not picking up your laundry. So it's a lot of that is just, it's fear mongering, and it comes from a place of love because we want people to get out of hurt. But a lot of times we don't educate people enough on what's the proper way to move. How do we kind of mitigate this pain? And I'm also quick to educate people when, especially that first visit, I'm a big fan of the stoplight kind of scenario where if you're in pain on a scale of 0 to 10, 1 to 3 is your green light. You can keep training. You're not going to do any harm, but you go by your go. When we get to that 4, 5, and 6, it's a yellow light. All right. So now something's irritating you. So we want to work on, do I need to decrease the weight? Do I need to shorten that range of motion? Or do I need to slow it down? Because when you actually slow a movement down, it kind of transmit less forces through those tendons. It's a little more bearable. And if we're going 7, 8, 9, 10 out of pain, you need to scrap that movement because it's going to potentially hurt yourself. You're going to compensate and hurt something else there. So a lot of times it's giving people permission to move, but with parameters.
And I love that because on the flip side, I get frustrated with the clients that don't address pain. But on the flip side, I'll have clients that say something is hurting them and a certain movement is bothering them. And I say, well, stop doing that. Let's change. They're like, no, it'll be fine. You know, it just did it. And I'm like, no, if it hurts like that, like we don't need to make it angrier. So yeah, there's like that. I love your stoplight method. I think that's amazing. That's so helpful.
I think that's really great. And I also think that a lot of times people think, well, my knee is sore. I can't train. I can't do anything. It's like, yeah, but what's wrong with the other leg? What's wrong with the core, the upper body? Like there's always something you can do.
Absolutely. And there's research show. So take like if you had knee surgery, or you mentioned you had your hip replaced, when you work the opposite limb, there are research that shows that there is a neurological carryover where you will get some strain. You are going to atrophy because most people they hurt something. You have the Rice principle, so rest, ice, compression, elevation. But if you hurt yourself and you shut yourself down, there's research show in that first 10 days to 3 weeks, they'll immobilize it. You have a huge effects on muscle atrophy, weakness, cardiovascular fitness goes down, and it just causes this whole plethora of issues. And if you stop training, it's so hard to get that ball rolling again.
Yes, we know that for sure. Yeah. And you are helpful to me because I recently had a shoulder sprain, and that has been challenging, but you got me out of a sling. Like, I was like, all right, I'm mobilizing, I do what I'm supposed to do. And then like I go see Josh, and Josh is like, okay, we're fixing to do some stuff with this. I'm like, okay, okay. That's so yeah. So talk to us about because ice versus heat, like when do we need to do what?
So there's plenty of research to support both. The biggest thing is I tell people for an acute injury, so within that first 3 days, you can ice it. It's gonna help kind of constrict those blood vessels, help manage swelling. They're finding out that it's not as beneficial as we've thought. And really, elevation is the more beneficial part. So let gravity do the work, pull it back to the heart. After you get outside that 3 to 4 day window, I like heat for the above tissue because one, it's going to help keep that tissue moving. We want blood flow going. It's also going to help with lymphatic drainage, which for those that don't know, your lymph system is your garbage system. That's what cleans the pipes out. So we want to promote blood flow through that area. So we've heard the Rice principle. They're now moving towards what's called peace and love. So the peace scenario is you want to protect the injured site. We want to still use elevation. We want to avoid anti-inflammatory medications because believe it or not, that your body does want that inflammation. Those first few days, it's bringing in the new tissue, and yes, it's achy. But I have patients who come in and they're just pounding all their NSAIDs, and it really just prolongs recovery. After that, we want to compress, and then again, still hammering home that education coming through. And then after that, once it's calmed down, we want to load it. Tendons and everything loves load. So you want to load it. We want to optimize movement. We want to really improve blood flow. And again, coming back home to education, keep training around it.
Yeah. And I think I think that education part is so important. And so that's why I do encourage people to, if they can seek out physiotherapy or physical therapy, it's great because things like, even if you have abdominal surgery, your doctor just says go rest, but doesn't tell you that, hey, you've got to do like there are certain things you have to do to get your abs firing again. So, both you and I, Alli, I know you have coached women that have had C-sections 20 years ago. They've never been able to get that transverse going again. And so nobody actually teaches doctors, they're doing the best they can, but maybe that's out of their scope of practice because, hey, once I took your appendix out, I'm done. Go, but there's so much more to recovery and getting that education from someone like yourself. And like a lot of the things, if people are curious, when you go to physical therapy, the band is not painful. You get band work that you do at home, that it's not like running a marathon. It's easy stuff, but it's those, secondary movers that are sometimes like just not firing that we need to get going. Thoughts on that?
I tell people that if I give you a movement your body's going to figure out how to do it. Now, is it the right way? That's what we need to hammer out. But that first initial visit, I mean, I want to layer it in. Your therapy should be challenging, because at the end of the day, I love the saying that strong people are hard to kill. The stronger you can get, the better off you're going to be. So
Yeah.
it should be very manageable mobility wise, and it should be something that you can throw in throughout the day. Like, there's one saying for exercise appetizers, like a little bit. Some people, we have a hard time with compliance, so they're not going to do 20 minutes a day of exercise. So if I can give you one or two exercises that you can diligently perform properly, it's going to pay dividends. And if I just want to meet the person where they're at, that's the biggest thing.
Yeah, and I what I meant to say is that yes, the exercises need to be challenging, but they're generally not, in my experience, the kind that have been like, oh my gosh, I need to go have a shower after this
Yeah.
because I'm in a hot sweat over it. It's challenging because you have to teach your body to move maybe in a different way, or activate a muscle that it's like, oh, I'm not used to moving in that way. You have to teach your body new ways of movement. So that's part of the challenge. It's not like, oh my gosh, I'm in so much pain.
Yep. Complete agreement with that one.
Yeah.
Yeah, and Josh, what about so we've talked about people in pain, but the whole idea of the Girls Talk Healthy Aging is to help people age in a healthy way. And so when we're talking about physical therapy, where does that play in, and how does aging affect the joints, and where does what you do play into helping women age as the best we can possibly, because none of us are getting any younger?
So we literally goes across all age spectrums, but their therapy should be set up to where we kind of diagnose your movements, look at if one area is compensating more than the other, such as hip tightness, knee tightness, back stiffness, really in that thoracic mid-back area where we'll see a lot of tightness. But we kind of improve that mobility through there. And then we want to load you up, because as we know, as we get older, your bone density decreases if you're not actively loading it. So helps battle osteoporosis. And we really want to be able to, there really isn't an exercise or a movement as we age that you really shouldn't be able to perform throughout every decade of life. And like, look at the senior Olympics. I mean, I've worked with men and women in their 80s and 90s who are running the 50-yard dash. They're doing javelin and discus throws. And basically, I clear you to move. I start you in that strengthening. And then that's where we move them on to group fitness classes, working with a strength conditioning coach to keep progressing for that. My goal with everybody is, should be, there's a saying with a company here in the States with Institute of Clinical Excellence, is you're old, not weak. And we want to keep progressing that strength, that functional mobility, because I want you to be independent in your 90s.
Yeah. Yeah. A lot of people don't think, you know, they're not as forward thinking as that, even just like putting your pants on. If you have to hold on to the counter to put, like, you just get lazy. It's like, okay, I'm
Yep.
not balancing on one foot. There's just so many things in our day-to-day life that you're not really thinking about, that you want to be able to continue to do. Like, like the whole squatting, we should all be able to squat because we want to be able to toilet ourselves well into, till the end. And
Yep.
so I really like your theory, because I think it's more than theory, is that everybody should be able to do, move their body in all ranges of motion well into their 80s, 90s, hundreds, because we're meant to move.
Absolutely. The whole motion is lotion saying, spot on. Because
Yeah.
as you move a joint, it lubricates, it fires up those tissues around it. When we have a lot of people who reach retirement age, a lot of people sit down, stop doing other activities, and those joints dry out. And that's what spikes that arthritis. And arthritis is an inflammatory condition. It's just a drying out and roughening up of the joint surfaces. So the more you can stress your body through all ranges of motion and challenge yourself, get your heart rate up, the healthier you're going to be in the long run.
What about people that have had a surgery, and how do they make sure? Because I also have seen this where I have clients that have had a joint surgery, and after surgery, sometimes they don't have the they're not pain free, or they don't have the mobility that I feel like they should have. And I'm sure you've seen that. So what do people need to be doing post surgery, and how do we address that?
So an issue that I've seen with a lot of people, once they get discharged from therapy, they think I'm doing the exercises. And to a point, yes, you should not be doing those exercises forever because your body is going to adapt to them. So you're going to get used to it. So they need to get progressed along. And that's where, like Shawna said, she goes in every 6 to 8 weeks just to get checked out to make sure things are moving properly. After surgery, everybody's surgery is going to be a little different because everybody's bone density and joint alignment is a little bit different. But you should really be working mobility daily. Should be a nice movement flow. But I have people that come in and see both me and my partner, and we just do movement screens. We show them. They'll come in once a month. We'll kind of update their exercises, give them stuff to tweak. And then there's a lot of coaches around town here that I'll talk to, like, hey, we need to modify this. And as they build up strength there, people should be amazed that they can sink lower into a squat. They can press overhead a little bit more because you might have that mobility, but if they didn't focus on that in-range strength, they're not going to be able to maintain or control it. So it's just kind of making a personalized plan to each person and staying on top of it.
And I think it's more than, mobility is very important. Flexibility is very important, but you can't have flexibility without strength, because that is where injury is going to occur. So you have to have this healthy balance between mobilization and strength at end ranges so that you don't, blow out your knee or whatever it is. And so it really requires a balanced program. So if anybody is out there that's like, hey, I'm good, I'm super mobile, it's like, well, you're also setting yourself up for injury if you don't have the strength to support that flexibility. So again, it comes down to education.
I tell a lot of people, look at gymnasts. Gymnasts are super mobile, incredibly strong. Where a lot of injuries happen outside of the freak accidents that happen during competition, it's their mobility didn't go away when they stopped competing, but that strength might have left. And if you lose that strength, like you said, you don't have that control all the way through. And that's when injuries happen. You get impingement, you get tears.
Yeah. And then when injury does happen, I think the problem with people waiting on, on like seeking out help for a niggle is that, oh, this knee is sore. So your movement pattern changes, and then you're messing up the opposite hip or the opposite foot or the shoulder. It's like, it just moves around. So if you address an issue, you're going to have less compensations. So, again, I've been really proactive with that myself, and found that, I have enough compensations just living. But then when I have an injury, I don't want to further have more compensations that I'm going to have to work around. So it's kind of like trying to keep things like a well-oiled machine. And I encourage, I'm going to get to my wish, because I encourage people to be proactive with their bodies. If you've got a niggle, or, don't wait until you're starting to limp, or letting it go too far where you're not enjoying the activities that you love. Josh, what if you had a wish for our listeners today, what would it be?
I just wish everybody play offense, not defense. If you have something that's irritating you, get in, get it loaded. Just because you've hurt yourself in the past doesn't mean this yearly cycle of pain has to continue. So pay attention, look at your sleep, look at your nutrition. If you can't figure it out yourself, have somebody else get eyes on you, and just be proactive.
Yeah, and that would be my wish, just to get a pro, like get the answers. Don't be afraid. Even if it is not what you're hoping for, it's better to have answers, and then you have options than to just continue to struggle. So go get the answers. And before we leave, I do want to give a shout out to one of our amazing Girls Talk Healthy Aging listeners, Miss Krista Clapsaddle, who has been listening diligently to our show. So thanks so much for your support and listening and checking out the Girls Talk Healthy Aging.
Thanks for listening. You'll find me, Alli, on Instagram at Alli Kerr Fitness. And you'll find me, Shawna, on Instagram at Shawna Kaminski. Feel free to pop us a DM with questions and or feedback.
If you're enjoying the Girls Talk Healthy Aging podcast, please subscribe and share it with other health-minded women. Ratings and reviews are also much appreciated and help us get our message out to a larger audience.
Until next time, be healthy and be happy.